Hello everyone. So now in this video we'll learn about the arterial supply of internal capsule as well as the basal ganglia. So we will start with the name of arteries. So this is internal carotid artery, this is anterior cerebral artery, and this is middle cerebral artery given its lenticular branches. Yeah, and then there are other branches of uh, this is the anterior choroidal artery, branch of the internal cerebral artery, and then we have this basilar artery giving posterior cerebral artery, which is giving branches here. Okay, now we will start with the how this internal capsule. So this is the internal capsule. Corticospinal fibers are mainly in the middle and the posterior limb, and so how the fibers are arranged is the hand the corticospinal fibers of the face are around at genu, and then the hand are in the middle of the posterior limb, and the lower limb are in the posterior part of the posterior limb. This is the main multiple choice question. Now coming back to the arterial supply. So this is the anterior cerebral artery. This is giving a recurrent branch of Hubner. This is the caudate lobe, head of the caudate lobe. This is the anterior limb of the internal capsule. So we need to remember Hubner owns the head. So Hubner supplies the head of the caudate lobe and the anterior limb of the internal capsule. Next, let's move to genu and posterior limb of internal capsule. Genu and posterior limb. The major blood supply come from the lenticular arteries, branches of the middle cerebral artery. However, the posterior limb also receives important contribution from the anterior choroidal artery. These also supply to the internal carotid artery. This is clinically important because occlusion of anterior choroidal artery can produce dense contralateral hemiplegia, because we have learned that the face and the hand and the lower limb are present in the posterior limb of the internal capsule, and specifically in the posterior part where their lower limbs are fibers are located, supplied by the anterior choroidal artery. Now let's move to the putamen. The putamen is mainly supplied by the lenticular artery, which arise from the MCA. These are the same arteries that are frequently damaged in the hypertensive intracerebral hemorrhage. And then moving medially, globus pallidus, that also receive blood supply both from lenticular as well as the anterior choroidal artery. Yeah, and then now the thalamus and the posterior part of the thalamus, the geniculate bodies. The geniculate bodies, they get blood supply from the branches of the posterior cerebral artery. Okay, and regarding the corpus callosum gets its supply from the anterior cerebral artery except for its posterior part. If we make a corpus callosum, it would usually go this, and this is spleen, and the splenial part will get blood from the posterior cerebral artery. And yeah, and then some questions regarding um, uh, posterior pituitary, which receives blood supply from the internal carotid artery from the inferior hypophyseal trunk. Okay, and now again regarding this chart which I have made. So if we need to remember some MCQs, head of the caudate will receive blood flow from the Hubner artery. Anterior limb will also get internal capsule will get supply from recurrent artery Hubner, and the genu will take blood from the lenticular artery. Posterior limb, that is important, the anterior choroidal artery as well as lenticular striate. putamen, GPI, all these will get from lenticostrid, but GPI internal is also from the anterior choroidal artery. And then geniculate bodies, these will get blood supply from the PCA, posterior cerebral artery. And then yeah, that's it. Yeah, thank you.